is celebrated in the cherished memory of Dr. Manu.V.L.Kothari, a visionary educator and thinker who emphasized the critical role of humanities in medicine. Manu, derived from Dr. Manu himself, and Smriti, meaning memory, collectively symbolizes the remembrance of his ideas and philosophy. Dr. Kothari firmly believed that medicine is not merely a science of diseases, but an art of healing humans. Through Manusmriti, we honor this very art, the compassion, the empathy, and the reflection that forms the core of medical profession. The Dr.M.V.L.K. Chair in Medical Humanities was established on January 23rd, 2016 to perpetuate Dr. Manu Kothari's vision to integrate ethics, empathy, and human understanding into the scientific training of medical professionals. Under his guidance, the division conducts lectures, workshops, and creative sessions, serving as a reminder that each patient is not merely a case, but an individual with a unique story, emotions, and a life extending beyond their diagnosis. Manusmriti stands as a heartfelt tribute to this vision. Annually, it convenes students, educators, and thought leaders to explore humanistic dimensions of medicine, to reflect, to express, and to rediscover the soul inherent in scientific practice. To further this journey, we will now revisit the essence of this chair and the enduring legacy of the man who inspired it all. We present Memories of Dr. Manu Sir through a short video clip.
मरीज मीन्स अ पेशेंट। मरीज की मुस्कुराहटों पे हो निसार, मरीज का दर्द मिल सके तो ले उधार, मरीज के वास्ते हो तेरे दिल में प्यार, डॉक्टर इसी का नाम है। माना डॉक्टर देखने में फकीर है, फिर भी यारो दिल के वो अमीर है। माना डॉक्टर देखने में फकीर है, फिर भी यारो दिल के वो अमीर है। मिटे मरीज के लिए वो जिंदगी, करे मरीज के लिए वो बंदगी। किसी को हो न हो हमें है एतबार, डॉक्टर इसी का नाम है। है मरीज के एतबार का, जिंदा है तबीब से नाम प्यार का, कि मर के भी मरीज को याद आएंगे, मरीज की आंसुओं में मुस्कुराएंगे। कहेगा हर मरीज मरीज से बार बार, डॉक्टर इसी का नाम है।
Thank you, sir. Okay. So we are deeply honored to have with us our esteemed chairperson of Dr. M.V.L.K. Chair, Dr. Avinash Supe sir. I request Dr. Supe sir to inspire us with his insights.
Thank you so much. This is such an honor for me to be here at this Manusmriti oration after I took this chair. And I think we all remember Dr. Manu Kothari, and for so many years he has taught us. And I think today we have a speaker, Dr. Almeida, whom I know for almost more than now, almost about 50 years. And I have seen his whole career, which is so, academic, ethical, and I think based on values. So I think thank you, Alan, for accepting this. And we all at this Humanities, we are extremely proud that you are giving this oration, and we are very happy about this. Thank you so much.
Thank you, sir. Your words undoubtedly inspire us to perpetuate the legacy established by Dr. Kothari sir. With your permission, sir, we'll now proceed to the evening's highlight, the Manusmriti oration. I now hand over the session to Dr. Padmaja Samant ma'am. Ma'am, please unmute.
It gives me great pleasure to introduce Dr. Almeida, who is today's speaker. He is undergraduate and postgraduate student of Seth GS Medical College and KEM Hospital, Mumbai. A postdoctoral fellow of University of Missouri, Columbia. He has been a faculty member here in KEM and GS from assistant professor's post to the post of professor and head. Before joining Hinduja Hospital. Currently, he is consultant nephrologist and transplant physician at PD Hinduja Hospital. He also serves as section coordinator of nephrology and director of clinical research. He has been paper setter and examiner of Mumbai University as well as the National Board of Examinations. He has served as office bearer on numerous nephrology societies, including Indian Society of Nephrology, Indian Society of Organ Transplantation, and Bombay Nephrology Group. He has been trustee of Indian Society of Nephrology, editor of former editor of JPGM, our own postgraduate journal of postgraduate medicine, and formerly on editorial board of Indian Journal of Nephrology. He has delivered numerous orations, Dr. Sunawala oration, Dr. Srimati V.N. Acharya oration, Dr. Chaube oration. He has more than 100 publications in various journals, numerous chapters in the textbooks, and served as chairperson of ICMR task force for project on chronic kidney disease and member of state advisory committee of transplantation. Over to you, sir.
Thank you, Padmaja. Thank you, Avinash. It's my pleasure to be delivering this oration, and I think I'll share my slides. Okay, can you see the slides?
Yes, sir.
Okay. Okay. Well, as I said, I owe this privilege to the Seth GS Medical College and KEM Hospital, the Dr. Manu.V.L.Kothari Chair and Division of Medical Humanities, and the Gosumec Alumni Association. And it's doubly pleasing to me. It's a privilege and honor to be delivering this oration in the centenary year of this institution. I hope I deliver an oration which is an honor to my teacher, Dr. Manu.V.L.Kothari. It all started with a call that came in from Dr. Lopa Mehta. And she said these very words, "Alan, I'm still alive." And the reason for this statement was that there was fake news which was going through various WhatsApp groups, indicating that Dr. Lopa Mehta was no more. But we all know she's alive. And the evergreen Dr. Lopa Mehta, the unassuming lady whom we have grown to appreciate over the years as she worked silently in the background, proceeded to invite me to deliver the Dr.M.V.L.Kothari Memorial Manusmriti oration. I could not say no, but had to negotiate with Madam for a date change, as the proposed date was clashing with an event that unfortunately could not be changed. My tryst with Seth GS Medical College started in 71. At that time, I had completed my interscience, applied for admission to MBBS, and having resided in the Nair Hospital campus since my birth, I opted for TNMC as my first choice. And that's where things changed. The Dean, Dr. T.S. Rindani, who had just moved from Nair to KM, convinced my dad that Seth GS Medical College was the place to be in. I made the right change and joined Seth GS Medical College in the batch of 1971. Ravi Ramakantan, who I saw on this webcast, Philip Abraham, Anil Tendulkar are some of my illustrious classmates, and I have a huge lot of them. Seth GS Medical College gave me lifelong dear friends whose friendship is priceless. We don't seem to get enough of each other nowadays as we relive our days at our alma mater and at our reunions. Well, I have my gurus, and memories would not have been so vivid if we had not received what we got during our formative years from stalwarts. Our gurus instructed us not just about diseases that were to be diagnosed and treated, but instilled in us all that we needed to be complete doctors, embodying the qualities of head and heart that would make us into doctors that were not intent on just treating the disease, but also the whole person. Amongst the many professors who combined to fashion us, we had none other than Dr. Manu.Kothari, who can be described in short as a learned scholar, consummate academician, beloved teacher, medical philosopher, friend, and guide. In our times, too, we had our own Shashi Tharoor, none other than Dr. Manu.Kothari, who had mastery over the English language. Some teachers provide instruction to be competent practitioners of medicine. Others also open doors that widen the further development of students and expose them to things that are not in the books but learnt from life. Dr. Manubhai taught us not just to imbibe the material in textbooks, but to also examine and challenge concepts. His work on the concept of cancer still echoes in my mind. Dr. Manu.Kothari and Madam Lopa Mehta co-authored many books addressing this new concept. A gifted teacher and a friend, his interactions with his students went beyond the student-teacher relationship. He humorously addressed me as Sir Alan. I never did comprehend why, but nevertheless enjoyed it tremendously. While traveling from the hospital's medicine department to the pathology department, I remember the stops we made at the Department of Anatomy and the time spent with Dr. Kothari as he regaled us and at the same time shaped our views on patient care. It is my privilege and pleasure to deliver this oration, feeling humbled as I recall the great personalities who have gone before me and delivered this prestigious oration. I deign to speak today to you about healing, something we all practice, yet rarely pause to define. As a nephrologist, my days spent recording patients' history and identifying clinical signs, interpreting lab values, prescribing treatments, managing dialysis prescriptions, and optimizing immunosuppression regimens. I delve into a deeply scientific, highly technical, and essential world. After nearly 5 decades in this field, it has dawned on me that the true art of healing is not only about health, but also about the heart and is sustained by hope. So today, I invite you to journey with me as we explore what it means to integrate health, heart, and hope. What I exemplify in nephrology remains applicable to the larger calling of medicine. So, this is the title of my talk oration today, The Art of Healing, Integrating Health, Heart, and Hope. Now, looking to the first dimension of health, contemporary recommendations exhort health practitioners to excel in the science, stay evidence based, and be lifelong learners. The boundaries of medicine need to be expanded through research, precision medicine, and technology. Some additional points I believe are important to focus on in this dimension. Let's start off with workload management. What I always exhort my students and I try to practice myself is be not only effective, but efficient. Work smart, not tirelessly. Be extremely organized, systematize your approach, and prioritize all things on your list for the day. And above all, ask for help if you're overwhelmed. Documentation is critical, provides a high quality patient care, and builds patient engagement and trust, enables a smooth transition of care, and ensures revenue integrity, and above all, provides protection against lawsuits. You need to treat the person as a whole. Avoid fragmented medicine. If you call in a cardiologist, he focuses on the heart, the neurologist on the brain, and the endocrinologist on hormones. Medications to improve one system may affect the other. Numbers could improve on the chart, but the patient may still feel worse. Where's the doctor who is responsible for the whole person? You need to be that doctor. Medicine is about more than extending life, and that's so in the present circumstance. Very sad, but an unavoidable reality for us doctors is we cannot save everyone. Modern medicine has moved away from heroic efforts to save all patients in the moment and focus on reducing suffering for as many patients as possible in the long term. Palliative care has made enormous strides in recent decades. So start focusing on improving life, the quality of life, rather than postponing its inevitable end. But above all, we must adhere to ethical codes. Mention is made of pharma-physician nexus, unwarranted surgeries, discrimination against the impoverished patient, and fee splitting. Ethical practices are needed to protect patients from harm, build trust, uphold professional integrity, ensure equitable treatment, and navigate complex medical dilemmas. Next, I've already mentioned this about personalized or precision medicine. It's a great thing that will happen. Represents a revolutionary approach, tailoring medical interventions to individuals based on their unique characteristics, the genetics, environment, and lifestyle. We're doing away with the one-size-fits-all model to a more targeted approach, which holds great promise for enhancing patient outcomes, improving treatment effectiveness, and reducing adverse effects. Doctors are definitely not God, but are ministering angels. When you save the life of a person and can see the magnitude of change affected by your efforts, it can be a truly fulfilling experience. Also, when the patient's relatives are so grateful that you become their family doctor and indeed an equal and a friend, it's once again a blessing. But a doctor, especially the budding doctor, needs to realize that we cannot save everyone's life. We also need to practice self-care. Physician, heal thyself. So many a hardworking doctor ignores his own illnesses and suffers the consequences of the same. If something feels a little off, get it checked out. Crashing every day will only lead to burnout. Get adequate sleep. Rest adequately, as it physically allows our bodies to recover without exhaustion. Also, it creates space where our minds aren't required to solve, analyze, or decide. Technology is important. Artificial intelligence has revolutionized many things: medical imaging and diagnostics, predicted diseases, accelerated drug discovery and development, enhanced surgery with robotics and AI guidance, and advanced genome research. However, while artificial intelligence can process data and improve efficiency, the heart of healthcare still lies in the human connection between clinicians and patients. So, going on to the heart of medicine, in nephrology, we become part of a world where patients on dialysis who are drained, disturbed, and demoralized. This is where the heart becomes a key part of our work. A patient once told me, "Doctor, what keeps me coming back to dialysis isn't just the machine. It's that care you express and the involvement you show when you ask me how I'm really doing." That comment, more than any presentation or publication, reminded me why I chose medicine. Reaching out to the patient doesn't require time. It requires your presence, a warm greeting, a reassuring touch, a smile which envelops your face and brings a smile on the face of the patient, a recognition of the person beneath the hospital gown. Yes, in a busy ward, that may be difficult, but never let the pressure of time strip away the compassion that attracted you to medicine in the first place. In my years as a medico, there are certain observations that I have made that may be useful to budding doctors and qualified ones as well. Listen, personalize, communicate effectively, and empathize are the key ingredients of a human connection in medical practice. What do patients want from their doctors? The 5 T's: your time, your transparency, your trustworthy care, your thoroughness, and your thoughtful communication. This is a very apt statement. We have 2 ears and one mouth, so it's better that we listen twice as much as we speak. And that's especially so when we are dealing with patients. So show interest in what the patient is saying, your mannerisms, how your body language translates, and active involvement like leaning towards the patient or maintaining eye contact goes a long way. Be careful not to interrupt the patient when he or she is expressing something, except for clarifications. I know from my years of experience that if I let my patients unburden themselves for 3 to 4 minutes without interruption, I will be privy to 90% of what's going wrong with them. Their diagnosis is written in the stories they tell. Pay attention to patients' verbal and non-verbal clues. A patient may tell you they are fine, but their facial expression speaks otherwise. Pay attention to the family members' verbal and non-verbal clues. The caregiver's furtive look or other non-verbal clues often tell a different story. Amusingly, when the patient is accompanied by a child, the child will spill the beans and tell the story of misdoings or misdemeanors on the part of the patient. As a father, I learned the importance of personalizing experiences for my children. What comes to my mind is something that happened years ago when both my kids were under 5. My wife was seated on the sofa, had our son on her lap to assist him in using the nebulizer. Our daughter felt left out, so my wife suggested, "Why don't you sit next to me and I'll put my arm around you?" My daughter pointedly asked my wife, "Sofa feels like a lap?" This helped me understand the importance of personalizing experiences for my patients as well. When dealing with a patient, it's better to address them by his or her name. And please do not fumble with the name after the patient is in the room. Make the patient comfortable. For the nervous patient, initiating a discussion with a general non-medical inquiry helps to break the ice. Personalized instruction rather than asking the patient to blood pressure should be, or rather telling the patient that blood pressure should be checked in the morning, the doctor can say, use your blood pressure device or check your blood pressure every morning. This sounds much better. Encourage patients to be a part of their treatment by asking relevant questions. And in this day and age, patients need to know, want to know. It's for us to provide the information. An answer from the treating doctor can ensure treatment adherence. They will like to know why they're doing it and feel empowered. If patients don't ask any questions on their own, ask them if they have any. Involve the patient in the decision making. The treatment plan must conform to the patient's understanding, beliefs, cultural values, and concerns to ensure adherence. The patient should never feel that you are rushed and that you are just making a visiting call. It's important to make each patient feel that they are the center of the universe. And patients apparently perceive healthcare profession to be in the room longer if they sit to talk to them. Standing gives the impression that the doctor is in a hurry to go elsewhere. Looking at your watch or keeping a hand on the doorknob implies that the patient in the room isn't as important as the one who is coming in next. You need to get to know the patient, the person behind the patient. Do we know the person beneath the patient? How many of us know the family of the patient or their jobs, what challenges or joys they are experiencing? Over time, if we make the effort, we learn their stories. The grief of a lost parent, the joy of a newborn baby, the silent fear of another hospitalization, all will come out. We may speak about long work hours being an obstacle, but as the proverb goes, where there's a will, there's a way. We need to be not just doctors, but doctors with a difference. There's an importance of communicating effectively, and is brought out by this humorous story. An English lady, while vacationing in Switzerland, fell in love with a small town and prepared to rent a room in a house. However, after she reached England, she realized that she had not found out whether the room had an attached WC. She wrote to the landlord inquiring about the WC facility. He didn't understand what WC stood for and thought it was walled chapel. So he wrote back to her, "Dear madam, the WC is just 9 miles down the road. As there are many people expected, I request you to come early. If you come on a Thursday, you will even experience an organ accompaniment. I have the joy of telling you that my daughter was married in the WC where she met her husband." Needless to say, that English lady was dumbfounded and flabbergasted. So we need to communicate effectively with our patients, and there are roadblocks which are listed here. So avoid them when you're communicating with your patients. Do not blame them. If you say you and you alone are the cause of your deterioration, that really breaks down communication. Labeling them as you are an irresponsible patient, or even being sarcastic and saying, "At this rate, you will reach the top of the health chart," or minimizing their problems. I can't understand why you can't exercise even for a few minutes every day, or threatening them. If you don't go on a diet, then don't come back to me for any treatment. These are roadblocks to communication. Instead, you could use I instead of you messages. So if you have a patient who does not turn up for his appointment, you wouldn't say, "Why didn't you come for your appointment?" That would be incorrect. Instead, say, "I felt annoyed when you booked an appointment but failed to come or inform me." Instead of, "What is there to feel embarrassed about taking insulin in front of others?" you could say, "I feel confused because you are bothered about the opinion of others instead of your health." Oh, don't talk down to patients. Some doctors do that because they wish to come across as superior. Great doctors show equality and speak in a respectful tone. Ask open-ended questions. Tell me about what's coming in the way of your adherence to the diabetes regimen, could be such a question. Avoid technical jargon. Instead of saying your hemoglobin is low, people may better visualize your red cells are low. Instead of your troponin level is elevated, indicating myocardial ischemia, it should be one of your heart blood tests is high. That indicates strain or lack of oxygen to the heart. The empathy is putting yourself in the shoes of another. Acknowledge patients' concerns, and acknowledging patients' fears or discomforts show that their feelings are valid. For example, I understand that this diagnosis is overwhelming. We are here to support you through every step. The other thing is use positive and reassuring language. Use reassuring phrases that offer comfort. Instead of saying, you must undergo surgery, why don't you rephrase it and say, this procedure is designed to improve your health and we'll be with you every step of the way. What about follow-up treatment? I was very touched when my dentist, after doing a bit of dental surgery on me, sent me a message asking how I was doing the next day. So follow-up after treatment, checking in on patients after their appointments show genuine concern for their recovery and well-being. A simple follow-up message, as I experienced from my dentist, or call can reassure them that their care continues beyond the doctor's office. We need to personalize communication, addressing patients by their names and referring to specific aspects of the care makes the communication feel more personal and less clinical. This is something which we are increasingly facing, dealing with difficult patients. And there are various types of difficult patients. The dependent type, you need to assure the patient that he or she will not be neglected and will be given full attention, and involve the patient in the decision making. The angry patient, reassure the patient that he or she will get the best medical care and there is no need to show anger. There are maybe a hidden emotion, so deal with the hidden emotion of fear or anxiety, or if necessary, even refer the patient to a professional. And then the frequent flyer. Try to understand what drives the frequent visits, concerns about undiagnosed symptoms, need for a reassurance, relief from chronic pain. Regularly schedule visits, refer to patient educator and support personnel. And the self-destructed patient. Set realistic expectations and recognize the fact that complete resolution is limited. Delve into reasons for non-adherence to therapy. It may be money, time, or family support, and arrange for the psychological support. And the last part was hope. In nephrology, hope can be elusive, especially when managing a chronic illness that is often without the promise of a cure. We see patients attached to machines, dependent on dialysis or transplant, or living with fear and uncertainty. And yet, hope is so very important. Indeed, it is the soul of healing. That spirituality plays a role in our patient's life is quite apparent by the statements made by them, such as, Doctor, bless me, Doctor, pray for me. And I've had this experience of a transplant patient who would not let me step out of the room without me putting my hand on her head and blessing her. And then that would make her day. I also vividly remember a young dialysis patient who wanted to have a transplant. And the transplant is going to be extremely complicated and risky. There were multiple antibody problems with the patient. But the young man was ready to take this step. I asked him what was helping him to forge ahead. He said positive affirmations, such as, I'm going to have a successful transplant. My body will accept the new kidney. I will heal slowly but surely. My medical reports will be normal. I will be leading a fulfilling life. The transplant went through. It was successful. And the last time I met the patient, he was overjoyed and gave me the great news that he was going to get married. I asked him out of curiosity what gave him the courage to go ahead. He said, faith in the divine. Miracle happens every day if we dare to believe. We do not hold all the cures, but we can always offer hope. That is why doctors should never use language that is bereft of hope, such as, there's nothing else we can do. She will not get better. There's nothing else we can do can be devastating for patients. Doctors are encouraged to say something like, therapy X has been ineffective in controlling the cancer, but you still have the chance to focus on treatments that will improve your symptoms and quality of life. Instead of she will not get better, the doctor could say, I'm worried she won't get better. The rationale behind the provider replaces a negative prediction with an expression of concern. Hope does not require a cure. Hope is the belief that tomorrow holds value, that suffering can be accompanied by dignity, that patients can still find meaning in family, in faith, even when health deteriorates. I recall a patient with end-stage renal disease who was denied transplant eligibility due to comorbidities. He said, Doctor, if I can attend my daughter's wedding next month, that will be enough for me. Our role then is not only to extend life, but to elevate it, to help our patients define what matters to them and to honor that deeply. False hope, however, is to be avoided. At the same time, don't give false hope to patients, such as you can fight and battle this disease and conquer it. This is incorrect, as patients may feel as if they're letting loved ones down by not fighting hard enough. Instead, doctors could say, we will face this difficult disease together to make it clear to patients that they have a team behind them. Another kind of hope that is detrimental is when patients expect doctors to be superhuman, work tirelessly day and night, respond to their calls and messages promptly, and so forth. Doctors do make remarkable contributions, but they're not omnipotent beings. A healthy relationship with doctors requires recognizing their humanity and the importance of a supportive patient attitude. I believe in forgiveness. Engaging in forgiveness can increase hope by opening a path to healing and reconciliation. Studies have shown that the act of forgiveness can reap huge rewards for health, decreasing the risk of heart attack, improving cholesterol levels, blood pressure, and sleep, as well as levels of anxiety, depression, and stress. Forgiveness has promising effects in patients suffering from myriad diseases, coronary artery disease to HIV to breast cancer to chronic pain. Interestingly, forgiveness is not only forgiveness of others, but also forgiveness of self. Forgiveness is important for healing as well as in dying. When I feel that my patient is dying, I ask the relatives to assemble the significant members around the dying patient so that they can communicate and, if needed, make their peace. To sum up about hope, we must preserve it even when outcomes are uncertain. We must be honest without being harsh, realistic without being cold, and clinical without being cynical. On a personal note, what makes my day? The patient who is returned to health, the patient who leaves my office with hope, the smile that returns to a sorrow-filled face, being told that I'm not just a good doctor, but a wonderful human being. So to every medical student beginning this part and every physician continuing on it, may your practice be distinguished. May your presence be compassionate. May your positivity be a beacon of hope. And may your patients always find in you not just a doctor, but a healer. Thank you.
Excellent, excellent, Alan. It was so.
Thank you, Avi.
It was so insightful, and I think with your personal examples and thoughts, I think it was really beautiful. I really appreciate the way you looked at when your daughter said about sofa, and how you really picked up and linked it to the patient. And your every stage you showed it how you could do always better and showed the value and positivity. I'm sure I remember Dr. Kothari and his words all the time when he used to look at patients and give them hope. So thank you so much. I'm sure it was such a wonderful talk. I'm sure we will cherish it.
Thank you so much. Thank you.
Thank you, sir, for this wonderful and really very comprehensive, thought-provoking speech, and your the title, "The Art of Healing: Integrating Health, Heart, and Hope." It was really a great learning experience for us. We learned a lot, and I'm sure our students who joined in this program today also have learned a lot from, as Supersir mentioned, from your personal experiences and how you linked them to patient care. You initially spoke about your days at GS and those unforgettable relationships Kothari sir had with the students. And you also spoke about the effective, efficient, and smart work and organized work. Apart from that, importance of documentation, ethical code of conduct, as well as importance of palliative care and AI, now artificial intelligence in medicine, palliative care. So many aspects you touched upon in your lectures are really very comprehensive and thorough. And one sentence or one quote which I liked is, medicine is about more than extending life. It was really wonderful. And finally, of course, about health, hope, positive attitude, compassion, empathy, importance of effective communication, as well as art of listening. So it was a pleasure listening to you, sir, and thank you for accepting our invite. And you joined us today in this Manusmriti oration to cherish memories of our beloved Kothari sir. So, as a token of our gratitude and appreciation, we would like to present a plaque to you, sir. So I request Badal to show the plaque. It is today we are, because this is online meet, we are showing
Yeah.
this virtually as a slide today. It will be later
Thank,
on delivered to you, sir. Thank you
thank
for
you
that.
so much. Thank you.
Uh, and we also thank our Dean Madam, Dr. Sangeeta Rawat, Academic Dean Dr. Harish Pathak sir, for their continuous support to all our activities of medical humanities. I thank Gosumec Alumni Association for their administrative support. Thank Mr. Badal Patil, Mr. Tushar Kotwal, and Suhas Maitre for all the technical support and maintaining our channel also. Mrs. Deepika Bhalekar, who is in Nostalgia part of GA, for helping in our all other administrative work and sending invites. I thank Avinash Supe sir, our chairperson, Lopa madam, and Ravi Ramakantan sir for as advisors, Padmaja madam for doing all the work, administrative work, and required for organizing this program, and student secretary of course Shubham Patil, who had joined here today. He compared the initial portion as well as organizing this program, and apart from that, other student secretaries, his co-secretaries, and last and not the least, all the audience who have joined here virtually today on YouTube and Zoom. So thank you very much, sir, once
Thank
again.
you. Thank you so much. Okay. Bye.
Very nice. It was, Alan. Enjoyed your talk.
Thanks. Thanks.
Thank you all very much.
Thank you.
Thanks for joining.